This is the second half of Maggie's consult. As you can tell already, this one's very complicated. It's typical of all your chronic illness where there's a multitude of factors that make this whole thing come together. So, this is your Health Reclaimed, where we expose roots that cause and fuel Lyme and chronic illness so you can finally heal, helping you understand the root causes of Lyme and chronic illness so you can reclaim your health and restore your life. I'm Dr. Brad Montagne, veteran functional medicine doctor. This is why we can typically get people healthy again that have been to multiple doctors, because we can put all this together and address everything that needs to be addressed. So we'll get into the second half now. Yeah, you do it with the hands, and it's a lot more successful. So that's another side of things to do with that. So we can address everything other than the spine at a distance. You know, if you come out here, we could prove we can do that. And I think that'd be a really good idea for you, because you've been to a whole bunch of caregivers that can't help much. And we can prove that on the first day. But the way we work with people is Mark Hyman, he's the number one functional medicine doc in the world. His extensive intakes when he sees a new person is 100 different tests. We're 4.5 times that. You gotta find everything going on inside of a person so you know how to address it and how it all ties together. So, a good friend of mine's a top functional medicine doc in a different part of the country. His metabolic tests are 52. We're 5 times that. And the reason why my testing is so extensive is we have to know everything going on day one, how it ties together and how to address it. So, my process, it starts with going through paperwork like this, because this gives you all what you filled out and what we're going over right now. This gives all the keys to everything that's going on and lets you know what root problems are likely to be in looking at this. So this is vital. You've got to spend time with this and understand it really well. The next phase is we either do this at distance or bring people in. We test urine for a bunch of metabolic markers there's no other way to do that are really accurate. We do some other evaluations with the BIA. And then we do muscle testing to find out everything that's going on. Process averages about 2.5 hours. And if I don't talk much while I'm doing it, we can do that and we talk afterwards. But we go through all the metabolic functions, all of the hormonal functions. We go through all of the gut issues going on with all the microbes inside. That's the first phase of testing. Second phase, we go through over 120 different foods, find out what foods are healing for you and which foods aggravate anything. So that's the second phase. With that, then you have a list of foods you can eat to actually build health rather than guessing all of the time. Then we go through infective issues, environmental toxicity issues, and by the time we're done, we know what all the metabolic functions are, what all of the hormonal functions are, what all the gut functions are, how liver's working, adrenal, thyroid, all of those interactions, what foods you can eat to promote healing, what kind of liquids you can drink to promote healing, and we know what all the infectives are, we won't know what the primary toxins are, and how to resolve all those on day one. This is where you get answers, not waiting. They're instant, they're immediate, and the first day, we're not waiting 6 weeks or more for tests to come in. We know on day one. And with that, we can test on how to resolve all of those things on day one. And it's so compelling the way that we test. 4-year-olds get it, and they'll tell their parents they don't want to keep doing what they've been doing. They want to do what the doctor they took them to today showed them, because they know we can help them. Because we prove it, not by what we say, but what we do. And that should help motivate you to realize, okay, somebody knows what they're talking about. Somebody can show me I can get better. And it's a whole bunch easier to follow things when you can trust that it's already been proven you can get better. Would you agree? So, if you went to another clinic and somebody ordered a bunch of tests to try and get less than half of the information we get, you drop over $9,000 to do that. We retest at the end of every month. So, and usually we start off with somebody like you with a 6-month program. By the end of 6 months, you're over 50,000 lab tests with no care at all. We're not even close to that. We don't even charge the lab fees for a total course of care for 6 months. For $7,500 for 6 months of all the testing, all the care. The only things on top of that is supplements. We know once we see somebody how much those are going to be. I've got 2 guarantees with our care. First one is if we cannot find what the root causes are on day one of what's causing everything and how to resolve it, I don't charge anybody anything. I don't give them any information I've found. We go our separate ways. In 4 decades, no one's ever taken me up on that guarantee. Because I always find it. Second guarantee is within the 6 months we haven't made significant progress in reducing metabolic function and the infective issues. I continue to work for free until we do. No one's ever taken me up on that. And we've had a lot of people that have been to top known specialists from all over the world that never could help them, and we get over 90% of them healthy again. That's an extremely high number. Extremely high. So, how's that sound to you? And as I said, so the only thing on top of that, there's no hidden costs, it's supplements on top of that. And we know once we do an evaluation what those are going to be. Those may start off, depends on what's going on, but those tend to reduce as we get down toward the end. And by the time we're done, okay, so this is what you can expect. This is our track record history. On average, H. pylori, you can guarantee you have that in the stomach, beating up your stomach acid with the symptoms you have. It takes an average of 6 weeks for that to go away. You don't have to deal with it anymore. You look at Lyme disease, Ehrlichia rickettsia is almost with it all the time. That takes an average of 6, maybe 8 weeks max to clear. It's gone. Lyme disease, it's typically in that 6 to 8 week window. With what I see with you, your health's pretty beat up and you're not going to have a lot of nutrient stores. So that's going to be a little slower than that, but not hugely. Not 3 times that. You know, it might be 3 months instead of 2 to get the Lyme disease. Babesia is worse than Lyme disease. That's a single-celled animal that climbs inside your red blood cells and eats from the inside out. That makes it so you can't absorb oxygen, carry it, deliver it, or use it. That's the strongest as far as Lyme disease goes. Divergens is the strongest form of that. That takes an average about 4 months to clear. The lesser forms usually 3. You'd probably be a little bit longer than that. We're not talking twice, just a little bit longer. It's going to take a while to build strength in you. What really takes the time to heal is the gut, the candida, and all that. So that's going to take at least the full 6 months. We might have a little cleanup after that, but not the intensity of what we started with. We start working with people weekly. That lasts an average of about 6 weeks, and then we go to once, twice a week. There's so many changes that happen quickly. You got to stay on top of them because things change, and you have to change what you're doing. So there's a lot of changes with this. There's nothing generic. All we do is individualized custom care. So you don't get a generic sheet that everybody else gets. We test to find out what you have. We test on what you need to heal that, and that's going to constantly change, and we got to stay on top of those changes and change that. Does that make sense? If you don't follow that style of testing and reevaluating, you get the experience that you've had. You just don't get people better. Can you hold your phone a little closer, because I'm only getting, it's still cutting in and out, but the difference is this. We have a lot more tools to deal with. I've got an extensive understanding of physiology, and I've got a track record of 4 decades of resolving things that nobody else can. The best specialists out there in every field. We're over 95% resolution of people like you with Lyme disease, back to full health. And you don't find anybody else that does that. Yeah, well, I just went over what's going on with that, and the way that needs to be managed is for somebody to understand that. That's something that I couldn't reach through a phone and do, but can explain how somebody who works in physical medicine, who's mechanical, on some very creative ways to address that and get that to do a lot better than what's going on right now. Because with the pictures that I see, I don't see disc bulges and I don't see impingement of the cord itself. I see structural issues that create a lot of mechanical problems, and those things can, with the proper therapy, increase that function and make that much, much better than what it is. As I said, from what I see in the MRI, and if I had the disc, I could answer that question even more, but it does not look like you have an impingement. That means a restriction compressing the cord. It looks like it's what's called patent. It looks like it's free through that whole area where you have the growth plate injuries. It does not look like there's bulges going in and restricting the space. It looks like there's plenty of space for the cord itself. So that's the best way to answer that question. It's a weird hue, there's a weird blue to it, and I'm not sure why that is. And I could go up above and down below to prove that, because I've got a few shots here and there, but it does not look like there is a spinal cord compression. And it's the compressive issues that create direct spinal cord. There's also IVFs, those are the windows where the nerve roots go out in between all the vertebrae. I can't see those on that film, but it looks like the posterior elements of the spine are preserved, and it's the front part of the body that compressed. That's usually the way those injuries work, and if that's the case, the IVFs, the windows where the nerve roots come out, should be pretty well preserved. There are ways to address that will alleviate a lot of the issues, and what you have with the toxicity going on, what you have with the maldigestion going on, what you have with the inflammatory reactions with Lyme and all of that, it magnifies. It's like sticking a magnifying glass on your pain centers. There's nothing to calm it down. there is not one cause for the pain there. There's multiple. And the more you remove, the freer you are to be able to move. When you look at all chronic health problems, there's never only one cause. There's always many. And the more of those you can address and get rid of, the more you resolve the whole thing globally. If somebody just addressed the Lyme disease alone, without dealing with the gut, it's not going to make a huge difference, because the gut's a bigger issue than the Lyme disease. And I got hundreds of cases that prove that out to be, and I have the tools to find that. Not many people do. You look at spinal issues. I've got a pretty big background in orthopedics, radiology, dealing with chronic illness. So it's not like I'm pulling feathers out of a hat. I've got a long history of doing things. I used to teach people how to do this kind of thing. I've got a long history of working on what other people never knew what to do, never had the tools to do it, and restoring things, keeping people away from surgeries and all that. Over 80% of the people that were headed for surgery, we allowed them to not ever have it. So that's a different history than what you've dealt with before. Those techniques to do that are things that you can teach others. You can empower others to do it. You just have to find the right person who's willing to learn. I got flown out to Australia about a year ago now. Somebody in a similar situation like you with some severe spinal issues that no one knew how to do. I spent a couple of days, not a lot of time in those couple of days, with his chiropractor, who thought he was a lot better than he was, but he didn't understand what he was doing. He was a good adjuster, a mechanical thinker, and he was a good student. I taught him all kinds of stuff, showed him what we need to do, worked on him, and then had him work on me, coached him through that, and by the time I left, I had him working on his patient there. After working on him the first time, he thought he was really great, he doing really well. He had such a dramatic experience from that one visit. He told everybody that came in his office, some crazy yank flew out from the States to see one person, gave him a clinical upgrade. He thought I was going to sell him a bunch of stuff. I said, there's nothing to sell. It's all your hands. No tools, no equipment, it's all your hands. And he said the dramatic change in himself, he could think clearer, he could see better, he could focus more, he was able to do all of his work. And I told him, you spend some time with me and change your life, change your practice. He was arrogant, didn't think that would be the case, but he openly was telling everybody that walked in the office about what happened. So that's my history. Yeah, where you're going to be able to go in that, whether that's coaching or that's probably fairly realistic. How far you can get, we won't know until we find the right person to work with to do what you need. That's the biggest issue. We have to find somebody who's humble enough to be taught on how to manage what you have. It's not going to go away. It needs to be managed. And who manages it needs to understand what they're doing, what the mechanics are, so that they give you the best, freest life possible. And we won't know how far that is until we find that. Yeah, you might have to do with that a little bit more often than just weekly at first to get the ribs functioning and all that. But the key is they need to have the tools to restore the function, understand how to do it, how the ribs need to move, how to address those. There's some very unique ways to do it up there in the top of the spine that aren't taught. So there's a bunch of work to do as far as that goes. And no one can give a guarantee that you're going to be 100%. You can be a lot better than you are right now. And we won't know till we get that relationship established and somebody able to do that functionally. We're not going to know. And you're not going to know right away because all these other collateral issues are setting the stage for that to be way, way, way more painful than what it should be. Some of those are dietary, some of those are gut, some of those are toxicity, some of those are hormone. All that is what set the stage for the connective tissue problems and the protein problems and all that. And all that has to work together. There's not just one piece of the puzzle that's going to say, okay, this is going to be the magic thing to restore all of it. It's all got to work together. Very, very simple question. You have two things going on with a connective tissue problem. One, actually three. One, there's inadequate protein intake to supply it. Two, there's inadequate digestion to properly assimilate the proteins inside of the gut to give the building blocks to make the proteins. Connective tissue is protein. Three, the liver is what assembles 80% of the proteins into the chains, the folds of the chains, and sets those folds in harmonic vibrations unique to every species. 80% of that happens in the liver that's overwhelmed with toxicity and you can't build anything right. So on top of that, you have autoimmune responses against it from all the toxicity going on. So once you start dealing with the gut issues, the diet issues, you heal all those up, that drops the toxicity so the liver can start to do its job. You start to build proteins properly, and as you keep pulling the toxins off, the autoimmune issues just go away. There's a study in the American Journal of Pathology, I think it's 2008, where it explicitly states autoimmune disease resolves itself when you heal the gut. All autoimmune problems are from toxicity. So that has to be part of the picture because that's part of the pain pattern that's going on. Well, this is the best support that you can have because you are addressing every issue that's keeping you from that. There is no one who's going to say, I'm going to do this, and I'm going to give you all of that function back. You have to put all these pieces together to do it. And if you don't put it together, the reality is you will never achieve that goal. If you put them together, you have the highest probability of being able to make your goals and your desires. So you ignore one piece and it won't come together. It can't. So it's your best shot to have the best outcome you possibly can. If you can start to see some changes, jump in with both feet and commit, we can get you in the best place you can possibly be. We don't know what that is right now. But I'm being honest with that. I'm not candy coating things. I'm not giving you empty promises. We need to address everything that's creating all of that problem. And you will never get there if you don't address these things. That's a guarantee. You guys can talk this over. Let me know what you're thinking. I commonly do that with people. Typically it's $3,500 to start. 2 months later, $2,000. 2 months later, $2,000. Most of the testing, the heavy lifting, is up front, and that way we can start people and not break the bank with things. And I don't add interest on it. It's a lot of work to put this together. You won't find many people who can put all these pieces together and make them understandable. There's just not a lot out there. I got trained in radiology and imaging by one of the foremost geniuses who wrote the premier X-ray book, radiology book on musculoskeletal radiology. It's a rare experience. So, I've got a huge background in all this. You're just not going to find that very much. So I can talk about all the different aspects going on out of knowledge, not guessing, not candy coating, not giving empty promises. I gave you some time frames that I don't know anybody else in the industry that will tell somebody how long they can expect it's going to take to heal. No, I spent a bunch of years working construction. Lord got a hold of me, told me to quit work, go back to school, and changed the course of my life completely. Made me into somebody that I'd never met before. It was quite a long process. So he's brought me through a lot of different things, and in that, I got put in a position to teach when I was in college, and that put me rubbing shoulders with some of the greatest geniuses and clinicians the world had to offer. I rubbed shoulders with them a lot. I'm a good student. So I got pulled into my senior clinic by the clinic advisor who ran the orthopedic program for 5 states, and he tried to get me involved in the orthopedic program and said, I'm a dad, my kids need a dad, I don't need a plaque on the wall. And he finally ended the conversation with this. He goes, look, I know all the teachers that teach the orthopedic program. You as a student know more than 80% of the people that teach this. You need a plaque on the wall. I said, it has no value to me. My children need a dad. So, if I wouldn't have gone where I went, there was only 3 of us in the whole history of that school that had that position. It ended when I stepped down. There was only the narrow window of time when I went to that school, those 2 radiologists that spurred each other on. For those who paid attention, gave us an education that nobody has. So it's a very unique thing the Lord set up and He orchestrated that I didn't know what He was doing at the time. But it's pretty obvious looking backwards, His hand through all that. And that's where I got these things. He put me in positions with phenomenal teachers to learn all this stuff and put it together. This has been a very complicated case, and it lets you understand how complicated cases can be. A lot of times people think that there's some magic bullet for the one thing that they think the problem is, and that's never the case with chronic illness. There's always a multitude of factors. We have physical ones, we have infective ones, we have toxic ones, we have nutritional ones. This has been really complicated. So you learn a lot through things like this, and there's not a lot of people out there, not a lot of doctors out there that can put all this together, address everything, and really get you back on your feet again. So that's why we can get people that have been multiple doctors healthy again. So this year, Health Reclaimed, we release these every Tuesday or Monday and Thursday. So we'll see you next time. Thanks.